hash the looming shadow of tuberculosis, a resurgence on the horizon. The specter of tuberculosis, TB, a disease once thought to be receding into the annals of history, is casting a long shadow across the globe. Recent outbreaks in the United States and internationally are signaling a disturbing trend, a potential resurgence of this deadly infectious disease, fueled by a crippling lack of funding for public health programs. The implications are profound, potentially unraveling decades of progress and threatening a future where drug-resistant TB becomes a widespread and unconquerable foe. The alarming rise in TB cases isn't a random occurrence. It's a direct consequence of deep cuts to vital public health initiatives at local, state, and international levels. Agencies like the U.S. Agency for International Development, USAID, and the U.S. Centers for Disease Control and Prevention, CDC, cornerstones of global health security, have suffered significant funding reductions. These cuts have drastically hampered disease surveillance, prevention efforts, and access to essential treatments, creating a perfect storm for TB to exploit. The impact extends beyond the borders of the United States, crippling international efforts to combat the disease in vulnerable populations worldwide. These vulnerable populations, often lacking access to basic health care and living in conditions that foster the spread of TB, are now facing an exponentially increased risk. This isn't simply a matter of statistics and budget spreadsheets. It's about the lives of real people. It's about families torn apart by a disease that is preventable and treatable with adequate resources. It's about communities struggling to cope with the devastating consequences of a preventable public health crisis. The human cost of these funding cuts is immeasurable, measured not in dollars and cents, but in lives lost and futures stolen. One individual, James Brooks, an IT specialist from Idaho, is acutely aware of this looming threat. His dedication to fighting this silent killer led him to take an extraordinary step, a journey from the relative quiet of his Idaho home to the bustling corridors of power in Washington, D.C., driven by his concern. Brooks embarked on a mission to advocate for increased funding for TB prevention and treatment. His journey is a testament to the power of individual action in the face of seemingly insurmountable odds. Inspired by the work of John Green, the renowned author and vlogger, and his brother Hank, Brooks joined the ranks of the TB Fighters, a grassroots movement dedicated to eradicating TB. For nearly 2 decades, Brooks has followed the Green brothers' work, finding inspiration in their commitment to social justice and advocacy. When the opportunity arose to participate in a TB Hill Day, organized by Green and the nonprofit Partners in Health, Brooks seized it without hesitation. He booked flights, secured hotel accommodations, and prepared to make his voice heard. This journey was not merely about attending meetings. It was about directly engaging with policymakers and sharing firsthand accounts of the devastating impact of TB. Brooks' experiences underscored the urgent need for increased funding and highlighted the critical role of public health programs in combating this deadly disease. John Green himself, a figure with a massive social media following, has become a vocal advocate for increased TB funding. He understands the power of his platform and utilizes it to raise awareness and drive positive change. His involvement with the TB Fighters has been instrumental in bringing attention to the issue and mobilizing support for increased funding. The recent successes of Green and the TB Fighters in securing lower prices for the crucial drug bedaquiline and diagnostic tests demonstrate the tangible impact of grassroots advocacy. Their work serves as a beacon of hope, demonstrating that collective action can achieve meaningful results in the fight against TB. Brooks' experience on Capitol Hill was far more positive than he anticipated. The meetings were productive, and he's now actively following up with Partners in Health to ensure his Congress members receive comprehensive information on the crisis. His actions demonstrate the power of individual engagement and the importance of grassroots activism in driving policy change. But the fight is far from over. The resurgence of TB is a serious threat, and reversing this trend requires a concerted global effort. The cuts to public health programs must be reversed, and significantly increased funding must be allocated to bolster TB prevention and treatment initiatives worldwide. Failure to act decisively will only exacerbate the problem, leading to a future where drug-resistant TB becomes a widespread and devastating public health crisis. The time for action is now. The future of global health hangs in the balance. We must rise to the challenge before it's too late. The lives of countless individuals depend on our collective commitment to eradicating this deadly disease. The resurgence of TB is not inevitable, it is preventable. The choice is ours.